Hello and welcome to WJTS-inform. I'm your host, Bill Potter. We're going to find out about a new illness or a disease that not many people have, but is very important to talk about so that you may have to address it someday in the future. It's called PH, or pulmonary hypertension. Joining us in the studio is Michelle Reller, and she is a local person who is organizing a PH group, is a member of the PHA, which is the Pulmonary Hypertension Association. Michelle, are you an RN? Is it?
No, I'm not.
Okay,
I'm just a PH patient who wants to inform people on what this is and let them know.
Well, that is perfect. We're glad to have you here. Sorry about having PH, but we're glad that you're here to spread the word.
Thank you.
First of all, let's talk about what it is. What is pulmonary hypertension?
Pulmonary hypertension is extreme pressure in the arteries in the lungs. Unlike other hypertension, where the vessels, the arteries in the rest of the body are constricted, pulmonary hypertension is just in the lungs only and can cause issues with the heart. Could cause right heart failure if not corrected.
Now, I know diseases have been around forever, so this disease has been around forever. However, just recently, I guess it's been coming more to light.
Yes, very much recently. There are only 12 approved FDA drugs right now for adults. There are none approved for children. So research is always being done to try and find a cure, of course, as in cancer or any other disease for that matter. But the medicines are helping to relieve some of the pressure in the arteries. So it is treatable as long as the medicines work.
Okay, then you mentioned kids. Who gets pulmonary hypertension and how do you get it?
Anybody can get pulmonary hypertension. There is no age boundaries. There are no ethnic boundaries. Weight has nothing to do with it. I've had a couple people ask me, if you lose weight, will it go away? No. I've been this weight for probably 7 or 8 years and nothing's changed. No, nothing's changed. There was a 3-month-old at the last conference I went to, had the oxygen on, was born with it. So it can be hereditary, but there are no boundaries.
But you have idiopathic?
I have idiopathic, yes.
Okay, so that means there's no relation anywhere.
No.
You just happen to be the lucky number.
Exactly.
Okay.
Yep.
Now, what can be done to avoid getting this, I guess? If I don't have it now, I assume I don't, how can I avoid getting that? Is there a way?
I don't believe there is a way.
If I'm going to get it, I'm going to get it.
Yeah, exactly. If it's going to happen, it's going to happen.
Okay, now that would bring me to a question. How do I know I have it? If I go to the doctor, is this, oh yeah, sure, you got PH. Is that something they look for right away?
No, it's not. Not unless you go to a specialist, of course. I was misdiagnosed at first, as most or a lot of PH patients are misdiagnosed. It's often put off as having asthma or COPD or another breathing issue. You're given inhalers or another medication to treat it. Well, in my instance, the inhalers just weren't doing anything.
Okay.
I mean, I would take them on a regular basis and they just weren't helping. So I went to a cardiologist to find out something else possibly, and he said I needed to go to a pulmonologist immediately. He was looking at past test results that I had.
Okay, now we're talking about PH. There is COPD. That has to do with shortness of the breath.
It does.
It not?
It does.
Two different things?
Very much different.
Are they related
yes.
in any way?
No.
Just two totally separate things?
Two totally different things.
So how do you know which one you have? I guess a doctor?
Well, a doctor, yes. The doctor will do testing if, for instance, you have asthma or COPD and your inhalers aren't doing anything for you. They will do an echocardiogram, which is an ultrasound of the heart, and also or a right heart catheterization, which is how they found mine.
But this really doesn't have anything to do with the heart so much, does it?
It has an effect on the heart, but the heart isn't the issue to start with, no. The tension in the arteries in the lungs are so great that it causes the right heart to become enlarged. The right side of my heart is twice as big as the left.
Okay.
Because there's so much extra pumping that has to be done.
To go through the blood vessels in your lungs.
That's right.
Okay, so this is really a lung illness.
It is.
Okay.
It is.
Is there a cure?
No.
Okay,
there
so
is no cure.
Everybody's working to get a cure.
Exactly. We're working to get a cure. I've been to several conferences since I've had it, since I've been diagnosed, and every time I go to the research room, which they take blood, they do other testing, and then it's sent off to research facilities throughout the world to try and figure out how this could be cured.
Okay, but there are medications you can take to make it easier? I mean to ease your strain?
There
Is that really all it does, I guess? It's
just
kind
ease
of,
the strain. Yes, that's
Okay.
all it does. It lowers the pressures in the arteries so that it's not quite so bad. When I first was diagnosed, or before I was diagnosed, I couldn't walk up 3 stairs without clenching my chest because it hurt so bad. I felt almost like I was having a heart attack to some extent. But now that I'm on the medication, I'm on 2 different oral medications, and right now it's working. They're keeping the pressures at a steady, level, which the doctor's very happy with. But he has told me that I'm going to be ready for the next step, probably within not too much time, which is an IV pump, which is a pump that I will carry with me that will constantly, kind of like a diabetic meter,
Okay.
that your medicine is always constantly being sent to you.
That might
your
be
body.
easier then. You don't have to worry about taking it, but you
To
don't want to
some-
go to that
to
step.
some point, yeah.
Yeah.
I
All
told
right.
him I wasn't ready, and he's not ready to do it yet. So we're both on the same.
As
path.
long as you can stay where you are, that's what
Right.
you'd like to do. Now,
Right.
so this is a life-changing illness. I mean, you can't go running the marathons like you did.
No, I didn't in the first place, but
I don't
no.
either.
But yeah, it is very life changing. Doing simple tasks, taking a shower, doing your laundry, vacuuming the floor, just simple daily things that people take for granted that they do all the time, is just totally exhausting. If I don't do some of these things in the evening, I wait till the morning to do them. I might as well forget my day because it's just.
It wipes you out for
It
the whole
does.
day.
It just wipes me out.
Is this something that comes on quickly? I mean, or do you like, well, today I feel a little short of breath, and then a month later you go, I feel a little more short of breath, or is it like the next day you just, how does that? Because people out there watching are going, I might have those symptoms, but I don't know.
Mine was progressive, but for the longest time I was always told I had asthma, and I just put it off, believing the doctors, believing what they told me, until that day when I couldn't go up 3 stairs without stopping and panting and grabbing my chest. It was like, okay, there's got to be something else besides asthma going on here.
Well, with a lot of illnesses, people go, okay, exercise is the greatest thing to do. That's what you need to do. But in your case, you really can't.
No.
What is, the people watching now, what do you want them to know about PH, pulmonary hypertension?
I want them to know that it is a very rare disease, that anybody can get it. If you're not sure that you have been diagnosed with asthma or COPD and you're just not sure that these medicines are working, go to your doctor and ask them, is there another test you can do? If this medicine's not working for me, could it be? I'm not telling everybody that you might that you have
Right,
PH,
right.
but it is a possibility that there's something else going on.
Where can more information be found? If somebody goes, I think I'd like to find out more about pulmonary hypertension or help out in some way, what
More
can they do?
information can be found through the PHA, the Pulmonary Hypertension Association. They have been my lifeline. I can call any time, that 1-800 number. I can call any time, and they will talk to me. It doesn't matter who it is. There's a patient-to-patient support line for any of those who do have PH or who would like to know more about it. The 800 number is 800-748-7274. And there is another number as well that just goes to the PHA to also find out more information, which is 301-565-3004, or you could go to phassociation.org.
Now, I see you have this button that you brought, and most buttons I see have words on it. This just has zebra stripes on it. What's the significance of that?
The zebra stripes. For instance, if you hear a bunch of hooves coming, like a herd coming, you automatically think horses. I mean, for that instance.
Right.
There could be a zebra in the mix.
Which could be the pH.
Could be the
instead of
pH.
asthma.
Just because you have a breathing issue doesn't mean it's asthma or COPD. It could be pulmonary hypertension.
How serious
So
is
that's
this
where the
illness?
zebra. It is very serious. It could lead to right heart failure if undiagnosed. Even though I have been diagnosed and I'm on medication, it could still lead to right heart failure.
Meaning the right side of your heart has
It's
the
just
issue.
gonna
Because
give
that's
out.
the side that's pumping to the lungs?
Yes.
Are you getting less oxygen?
Yes.
Then through your blood system?
Yes.
Okay.
Right now my oxygen level is good, but oxygen is another thing that a lot of people with PH are on. I guess you might say I'm kind of one of the lucky ones. I'm just on 2 oral medications right now. So
Now, a lot of people we'll go to the doctor, and there's a blue million illnesses somebody can have, and we're not saying that you have this illness, but it's like most things on the Inform program. We just want people to know things, and the more you know, the better off you are.
Right.
Which is the point of you coming on this show and talking about it.
People come up to me a lot through my volunteer work and ask, oh, how are you doing? Well, I say, oh, I'm fine. It's hard to explain to people how much pain and hurt you're feeling on the inside when you look fine on the outside. It's an invisible illness such as asthma or COPD or depression or, you know, those things. Pulmonary hypertension is one of those invisible illnesses. So just don't judge unless you know.
But it is real. Now, I got to ask you this too. You pass out. Okay. EMTs are going to come up because obviously somebody's going to call the EMTs.
Right.
Your treatment, though, is kind of the opposite of what your symptoms may actually show. People think right away, short of breath, oh, you must be having a heart attack.
Exactly.
That's got to be treated as a heart attack. That's not the case, right?
No, not at all. If you give a pulmonary hypertension patient nitroglycerin, which is normally given if someone thinks you're having a heart attack, it will bottom our blood pressure out, because normally a PH patient has low blood pressure to start with. So it takes mine down to the level where they just pretty much take me out.
Wow.
Yeah.
Okay, so you need to wear a little bracelet or something. Or you,
Yes.
you said at one of your conferences somebody had a shirt that said, I'm an SOB,
Yes.
Meaning short of breath, not what you were thinking out there. So this is something to know about that disease. What about fluids? Do fluids?
Fluids are not good. Not good for a PH patient. A lot of people have, urethane fluid. PH patients are on an antidiuretic, or a diuretic, not an antidiuretic, but a diuretic to help release that fluid. Don't automatically, we tell EMTs or my band says, don't start IV. Put the IV in if you must, but don't start any fluids unless you know for sure what's going on, because the fluids just aren't good to just pump a bag of fluid in me. I swell up like a balloon, even more than I am now.
So that's not good.
No,
so
not
I guess
good.
you have a little note here. Eat an apple, don't drink apple juice.
Right.
Okay, better to eat the solid foods.
Exactly. Eat the solid foods. It's still good for you, but don't drink the fluids.
Okay, Michelle, is there anything else that you would like to point out about this illness for people to know?
I just want to bring awareness to this illness and let people know what it is so they can be more informed and to maybe help others. I am starting a support group in the local area. My website is out several different places. I've got business cards passed out. It's mlreller@yahoo.com. Please contact me. Make a note in there that you want to know about PAH or anything about the pulmonary issues. And I will probably know within a month where my meetings are going to start. The Pulmonary Hypertension Association is always looking for donations to research and to try and find a cure. And my support group is also going to be looking for donations because we have to ensure the cost of the place that we meet. We do have drug reps that are going to come up. Anytime I call, they will supply the food and any brochures or pamphlets that I may need to pass out, and speakers for the meetings, but they will not supply our meeting place. So I'm looking for a meeting place or contributions to help with that.
Michelle, thank you so much for coming in. Michelle Reller has been our guest. She is a pulmonary hypertension patient, and we just really appreciate you coming in to help enlighten people about another illness that's out there that you may help save somebody's life. We don't know. If you'd like more information, contact Michelle. We thank you for watching WJTS Inform. We are local people watching local people.